I don't know whether you've heard, but I'm offering some spaces in my calendar for supercharge your fertility discovery calls. So this call is for you if you're ready to get pregnant naturally or improve your chances at the fertility clinic. We take a functional approach to fertility. It's the future of conventional medicine. There is a reason that so many medical professionals work with us. The approach is rooted in science. The call is for both you and your partner, and all you do is go to FabFertile, FabFertile.com and click on book a free call. Then you'll be booked in and ready to spend the 30 of the most valuable minutes on your fertility ever.
Then I think part of it is just allowing for that transition off the pill and recognizing the fact that this is the first time, potentially the first time the body's had a chance to ovulate in years, if not a decade or more. So it's about being a little bit patient too and letting that the ovulations kick in and potentially not resorting to fertility treatment too soon.
Welcome to Get Pregnant Naturally, where functional medicine and natural fertility solutions will help you get pregnant and have your baby.
Hey everyone, I'm Sarah Clark, and my mission is to inspire, motivate, and empower you. And most of all, I want you to wake up. So with functional medicine, we can discover what causes infertility and eventually reverse the condition. Today, I'm welcoming Dr. Lara Briden to the podcast, and we're digging into why repairing your period matters for fertility. Dr. Lara Briden is a naturopathic doctor and the period revolutionary, leading the change to better periods. Informed by a strong science background and more than 20 years with patients, Lara is a passionate communicator about women's health and alternatives to hormonal birth control. Her book, Period Repair Manual, is a manifesto of natural treatment for better hormones and better periods, and provides practical solutions using nutrition, supplements, and natural hormones. Now in its second edition, the book has been an underground sensation and has worked to quietly change the lives of tens of thousands of women. Lara divides her time between Christchurch, New Zealand, and Sydney, Australia, where she has her consulting rooms. She's helped thousands of women find relief for period problems such as PCOS, PMS, endometriosis, and perimenopause. Check out her website at larabriden.com, LARABRIDEN.com. And before we jump into today's show, don't forget to hit the subscribe button on iTunes or wherever you're listening to this to make sure you never miss an episode. Hey, Lara, excited to have you on the podcast.
Hi, Sarah. Thanks for having me.
Yeah, awesome. So we're going to, if you could share your story as to how you came to this work, into this field.
Sure. So I've been working as a naturopathic doctor for more than 20 years, just working with a lot of women through those years, helping them to have better periods. And I just came to realize that, of course, women don't have a lot of other options from their doctors at this stage. You know, the pill is prescribed for almost everything and is really only a Band-Aid at the best of times. So diet changes, nutritional supplements, herbal medicine can work really well. So about 3 or 4 years ago, I put that all into my book called Period Repair Manual and put that out into the world. And yeah, I think that's managed to help a lot of people, which is really exciting.
Yeah, the book is absolutely amazing. And you have a revised edition as well that just came out. When did that come out?
Well, it's been about 1.5 years, I guess. Yeah, since it was just a bigger, more references, more treatments. I expanded some sections. I added a whole section on perimenopause, which is actually quite important time that doesn't get a lot of attention. So, yeah.
Awesome. So, yeah, definitely check out the Period Repair Manual. We'll have some links to some free downloads for you at the end. So if you could just kind of share with us, so why is our period the monthly report card, and why is that so important?
Yeah, it's a handy barometer of how we're doing. So to be able to ovulate every month, which is the main event of the menstrual cycle, we need to be fully nourished, to not have insulin resistance, to not have a thyroid problem, to not have, too much stress or chronic inflammation. So in that way, the period is a great marker of health. It kind of tells the story of health. And I've said a few times that and I mean this, I feel sorry for men that they don't have this handy barometer or monthly report card to check in with.
Mm-hmm, mm-hmm. And so the signs of a healthy period, what does that look like?
Yeah, so a healthy period is one where ovulation occurs, a menstrual cycle where ovulation is the main event. The total days between periods, so we should, from counting from day 1 to day 1 of our next cycle, our periods should come about every between 21 to 35 days, up to 45 days if we're young, if we're a teenager or in our early 20s. A longer cycle is fine. And the period should not be difficult in any way. I mean, I'm trying to raise the expectation of what a period should be like. Certainly it should arrive with no pain, not too heavy, and not too many PMS symptoms.
And I think for a lot of us, myself included, so I had these irregular periods, and bad PMS, heavy periods, in bed for a day, and like sort of it would come and you sort of dread it. And a lot of people have that, or it may not come at all. So as you're saying, not difficult. It just comes, and it's 21 to 35 days, and it's really kind of really a non-event.
Yeah, and sort of anywhere between 2 to up to 7 days bleeding, I guess, would be normal. There's a bit of variation in there. Losing no more than 80 milliliters of menstrual fluid over all the days of the period, which is really only a few tablespoons of blood. It's not all blood. Some of it's just mucus and other things like that. Mm-hmm. And I genuinely believe that that's possible for most women to reach that stage where their periods are fairly straightforward and not debilitating in any way.
Mm-hmm, mm-hmm. So women listening to this podcast, Get Pregnant Naturally, are obviously trying to conceive. So let's just dig in. You have a lot of stuff in your book to help with that, to look at, to you using the period as a barometer for that. But so what are some reasons for not ovulating?
Yeah, sure. Let's go through that. Mm-hmm. To begin with, there are lots of possible reasons. So the doctor needs to work through that. I talk about that in my book. In chapter 7 of Period or Perimenopause, I have a little kind of section where you go through. It's like, are you pregnant? That's the first, should be obvious question. Even if if you're not getting a period, then is your prolactin high? Has the doctor tested for celiac disease and all these various things? And at the end of all of that, not ovulating comes down to usually one of two things: either hypothalamic amenorrhea, which is essentially undereating, intentionally or unintentionally, or the second cause of not ovulating is PCOS, or polycystic ovarian syndrome. And there's a little bit of confusion between those two situations, which we should probably talk about, because I've had so many readers and patients who were, for example, told they have PCOS only to discover years later they actually have hypothalamic amenorrhea. So to find out that the treatments they'd been trying to do were actually wrong and not going to bring them to ovulation the way they'd like to.
Yeah, I did have Dr. Nicola Rinaldi on the podcast talking about HA.
Yes.
Details. Definitely you can check out that episode. The sort of, and then also with PCOS, there's a lot of different types of PCOS. I don't think a lot of women know necessarily which one they have. And let's start with, actually, let's talk about it for a minute. Let's start with the confusion between PCOS and hypothalamic amenorrhea, or HA. It's the problem comes down to the fact that, unfortunately, a lot of doctors rely on an ultrasound finding of polycystic ovaries to so-called, supposedly diagnose PCOS. But the condition cannot be diagnosed that way. And it's important to understand that polycystic ovaries on ultrasound can mean nothing. I mean, they can be present if you have normal hormones, normal periods, normal ovulations, everything. You can still sometimes show ovaries that look polycystic on ultrasound. You can have ovaries that look polycystic on ultrasound when you have hypothalamic amenorrhea or undereating. And also you can have polycystic ovaries on ultrasound when you have the hormonal condition of PCOS, which is a condition essentially of high male hormones. But you can also have normal looking ovaries on ultrasound and still have PCOS, or the condition of high hormones. So I hope that is at least prompting some of your listeners to really question the ultrasound finding, and maybe to go back to the doctor and find out, if they were given the diagnosis of PCOS, then how was that diagnosis arrived at, and have a conversation about that. To dig deeper. Yeah. And then you talked about elevated prolactin. Did you want to go into that for us for a little bit?
Yeah, well, that's just part of the workup that the doctor should do at the beginning. So if there are irregular cycles or no cycles, or evidence of what's called anovulatory cycles, where you still have a bleed but haven't ovulated, then measuring prolactin should be one of the things they will usually do. If prolactin, it's a pituitary hormone, it can be high for different reasons. I mean, it can be very high due to an actual problem with the pituitary, in which case that's definitely something that an endocrinologist would need to be involved in. But it can also just be a little bit high. So having prolactin that's a little bit high can be from stress. It can be just really temporary from, eating or post-exercise, which is why in my book I talk about the parameters. When you go to have a prolactin test, you should make sure that you're resting, that you haven't just come straight from exercise, that you're not stressed, that you're preferably in the follicular part of your menstrual cycle. Those are all ways to get a more accurate prolactin reading. And then again, not start thinking that you have high prolactin when maybe it's not the problem at all.
And you mentioned celiac disease.
Well, that's supposed to be part of any infertility workup, actually, is to screen both partners for underlying celiac, because when there's a gluten problem, gluten can really be a problem for ovulation. It can impair ovulation. That's the first patient story that I include in Period to Perimenopause. I think it's in chapter 1. It's maybe the second patient story. No, I think it's the first one. Is just a young woman who'd always had irregular cycles, probably was not ovulating with many of those cycles, and then we discovered that she had an underlying gluten problem, and that helped to fix removing gluten, helped to fix some of her period problems or some of her skin problems, other problems, but also went on to give her a regular cycle. So that's just another example of how our period is our monthly report card.
And I think if I remember right, in that story, I think you then said, and it wasn't until 3 months later until the ovulation came back, because it's 90 to 100 days for the egg to renew itself. So it's not just like, wow, we go gluten free and then things improve immediately. And also, I guess with the celiac disease, there could be false positives because the technology they're using to test could be outdated, and they're only looking for, I think it's like they test for one or two proteins and gluten, whereas there's actually like 75 to 100. I had Dr. Tom O'Brien talking about this, and he's recommending the wheat Zoomer to dig into possible gluten issues, and he's recommending, and we recommend it as well. I'm not sure about yourself, to go at least dairy and gluten free for 90 days and then dig into possible gut infections, because even if the celiac comes back negative, there still could be non-celiac gluten sensitivity.
Yeah, totally. No, he's right about that. The standard blood test can give a false negative. I also look at just signs and symptoms of possible gluten sensitivity. So certainly a family history of any autoimmune disease, having the condition of psoriasis. That's the patient story I give in the book. I find the psoriasis to be quite a clear marker of gluten sensitivity. Yeah. The other test I use, which is not officially to be used this way, but the test called thyroid antibodies, or the autoimmune thyroid, having the thyroid antibodies present, to me is a pretty clear marker of a gluten sensitivity as well. So there's different ways to assess it. But I think if you can access one of the more sensitive gluten screens, then that is worth doing. And it's true, it's for both partners, because gluten sensitivity can affect sperm quality as well. Absolutely.
And then the thyroid piece. So I think a lot of times people just think of looking at the TSH and they don't dig deeper. What's your take on that being as a related to not ovulating?
Well, not ovulating, and also not being able to hold a pregnancy or establish a pregnancy. So that comes back to what I just said a minute ago about thyroid antibodies. That test for autoimmune thyroid disease, even subclinical autoimmune thyroid disease, is very helpful for assessing both what's going on with periods and potentially what's going on with fertility. Like I said, I kind of use the thyroid antibodies marker as almost a surrogate marker for gluten sensitivity.
Okay. And then as far as, I'll just have this little question in here about your thoughts on tracking devices, fertility awareness method. What's your take on, if you have a favorite tracking device? Or
well, there's so many new ones coming on the market all the time. And the one I talk about in the book is Daisy, their fertility tracking device for avoiding pregnancy. That's why I sort of included it in that section of the book. I mean, for achieving pregnancy, there are, obviously Daisy can be used that way too. There are lots of other ones. One thing to just keep in mind, I think to be meaningful for tracking fertility, you really also do need to look at cervical mucus, fertile mucus, because that together with temperature and together with tracking, that's going to give a much clearer picture because, of course, as you know, and I'm sure all your listeners know, the fertile mucus comes first before ovulation. And that, that gives you a better opportunity to time intercourse on the right day. By the time your temperatures go up, of course, it's too late for that cycle, although that can be good confirmation that you did indeed ovulate.
And what about those ovulation predictors kits or?
Yeah, the LH. They're testing a hormone called LH. Mm-hmm. I think it's reasonable, and I'm sure you probably know this, but the one caution about that is anyone with PCOS or subclinical or low-level PCOS is going to see a highish LH a lot of days, so that can lead to some false positives for the ovulation stick, which can be confusing. So, yeah, I think if you know, it's probably best used in conjunction with the cervical mucus. Once you start seeing the mucus, then you can start testing the urine and watch for that. Yeah, a proper LH surge.
Mm-hmm. Yeah, I think a lot of women, this is something that we're typically taught to figure out what our, how to look at our cervical mucus. And I think it's that fertility awareness method really goes into depth about that. And the podcast Fertility Friday. So Lisa Hendrickson-Jack is a fertility awareness method educator. So she's got some really cool resources on there to check out. And she's got a new book, The Fifth Vital Sign. So
yeah, I just talked to Lisa this morning.
Did you? Oh, yeah. Cool. Yeah. I have her books in here and your book.
Great. Awesome. And I think girls should be taught body cycle tracking, body literacy, reading fertile mucus as teenagers. I feel like that should be something we learn early on, is what that means when the body's doing that.
Mm-hmm, absolutely. So as far as metabolizing estrogen, so why is that important for period health and fertility?
Yeah, well, that's getting into the territory of if there's a problem with what's called estrogen excess. Sometimes people say estrogen dominance. I actually don't like that word. But estrogen excess mainly can be a problem because it can cause symptoms of heavier periods, breast tenderness, potentially PMS. It's, we metabolize estrogen through our gut. So it's a big part of estrogen clearance is about keeping the gut healthy and the gut bacteria healthy so they can metabolize estrogen into some safe metabolites and remove it from the body. I don't know, actually, to be fair, I don't know that estrogen excess is a big problem in the fertility side of things. I think from the fertility side of things, it's more about ensuring that ovulation is happening, that you're getting a nice level of progesterone coming in the second half of the cycle, and that the immune system is happy for fertility, and that the male side of things is covered. Because I don't work a lot with fertility. Actually, most of my patients are coming just for general period health. Mm-hmm. And one of the reasons I don't work a lot with fertility is because I'm treating women. And 50% of the time, fertility is a male issue. I'd say more than 50% of the time. I can't tell you how many times I've been sitting there with a woman who's worrying, micromanaging every aspect of her cycle. And I'm saying, look, you're fine. I think the problem is the sperm. Even if your standard sperm test said it was good enough for something, there's still so much more that can be done from the male side of things.
Absolutely. Yeah. We work with couples, and every time then it's typically female factor infertility, but every time the man's over here waving his hand going, I'm fine. And then we look at the blood chemistry, do a review, and then dig into, you should do a stool test. And it's like, oh, there's things to work on. There's things to do. It's not, it's not just one person making all these changes, these diet and lifestyle changes. It takes two to tango.
Well, and doing a proper semen analysis, which involves looking at sperm morphology, because here's the interesting fact. I don't know if your listeners know this, but the morphology of sperm, which is the DNA quality, is the shape of the sperm, is affected by the testicular microbiome. So we have a microbiome everywhere, not just in our gut, right? We have a microbiome throughout the body. We have a microbiome in the uterus and the vagina. That's important for fertility from the female side of things. Men have a microbiome.
I haven't heard the testicular microbiome. I've heard of all the other microbiomes. Okay, sure.
Yeah. So if a guy has a microbiome problem in general, there's a possibility that it's affecting his sperm morphology. So that you can see what I mean. It's such a fertility. I'd say really only, I think the numbers are something like, if you break it all down, like problems with ovulation really only account for less than a quarter of fertility problems that are out there. It's an important part of it for sure to be able to ovulate, but that's just the first step. You then need so many things happening, including the immune system of the woman, the immune system of the man, the microbiome of the man, fully nourished for both sexes.
Mm-hmm. Mm-hmm. Absolutely. And so the reason for impaired estrogen, so you talked about gut health.
Yeah. So the other thing that's going on with estrogen excess, when we speak about estrogen excess, is that for a lot of women, I think there's a component of histamine or mast cell dysfunction. So that's part of the immune system. It's an interesting thing. I have a couple blog posts about it. One called The Curious Link Between Estrogen and Histamine Intolerance. Mm-hmm. Histamine, that part of our immune system, is actually involved in ovulation. It's a stimulating neurotransmitter. It's obviously an inflammatory part of the immune system as well. And so having too much histamine stimulates more estrogen, and having more estrogen stimulates more histamine. So you can kind of get this runaway overstimulation thing happening, which can make periods heavier, can cause irritability and PMS. And again, from a fertility side of things, if I think that's just part of the knowing that there's an inflammatory response going on and working to calm the immune system, and that will potentially improve fertility in lots of ways.
Yeah, and histamine, typically, if you get that flushed face, I know when I was doing the red wine,
yes, exactly. So flushing with red wine, that's a histamine.
Yeah, or even having, like, I think you're doing the kombucha or the what's the other one? The fermented sauerkraut, or the sauerkraut, and it's like, oh, why am I flushing? Histamine issues.
Yeah.
Those fermented.
If you think about histamine, really does play a role in fertility, because I think you probably know that taking antihistamines can be a problem for cervical fluid and proper estrogen signaling leading up to ovulation.
Mm-hmm, mm-hmm. And so signs of chronic inflammation, which you touched on a little bit, what would those be?
Well, signs of chronic inflammation would be headaches, I guess fatigue, potentially skin problems, joint pain. Depends what kind of inflammation you're talking about. If it's more that temporary histamine inflammation, that's going to look probably like headaches and flushed face and swelling. If it's a different, more autoimmune inflammation, this brings us back to, we did mention before about autoimmune thyroid and thyroid antibodies and how that is important for fertility. That's a type of inflammation, right? So that's showing up in that case in thyroid disease, ultimately, sort of autoimmune thyroid.
Yeah, we regularly see this myth. The thyroid dysfunction has been flagged as normal over and over again. I'm sure you see the same as well.
Yeah, and it's worth doing that extra test for thyroid antibodies. To say that again, that's probably the single most important next step test to have for thyroid and fertility.
Absolutely.
Because they've linked, as you probably know, having positive thyroid antibodies is a increased risk for miscarriage. Kind of makes sense because the immune system is important for holding a pregnancy.
And then running that CRP blood test, is that part of your workup you do?
It can be. CRP, it can measure lots of different kinds of inflammation. It's just bear in mind, you can have quite a bit of inflammation going on and have a normal CRP. So no, I don't. You don't rely on that. I'm looking more for symptoms usually. Bring it back to that first patient story in my book where she had psoriasis, which is a marker of inflammation and autoimmunity. And then, in her case, gluten was the driver of that inflammation.
And then far as there's a lot of buzz about this right now, the environmental toxins and the impact on estrogen.
Yeah.
Mm-hmm. Did you want to talk a little bit about that?
Yeah, that's a huge topic. But I will say, so the issue potentially with environmental toxins is that they, not just that they're estrogenic, but that they can impair hormonal signaling in lots of different ways. One of the more, concerning way would be that the way they potentially can impair ovulation. I just want to bring it back to hormonal birth control. I know this is a podcast about fertility, so obviously most of your listeners are no longer on hormonal birth control, but I would say that having been on hormonal birth control can also be a reason for impaired ovulation or not able to get your periods going, just from the potentially years of being on suppressed ovulation. So I know I kind of segued from environmental toxins back to the pill, totally. But it is knowing that it's funny how we just talk about so many potential environmental toxins out there or endocrine disruptors, and hormonal birth control is one of the biggest endocrine disruptors out there, and we somehow don't put it in that category.
Absolutely. I had Dr. Jolene Brighton on the podcast
Yes.
talking about post birth control pill syndrome, and a high percentage of women that I speak with that are dealing with infertility. I'm like, have you been on the birth control pill? And the answer is like 80% probably yes. And then I asked them, well, why? And a high percentage of them, again, probably 80% say because when I was 16, I had irregular periods, or they heavy periods, or I had acne, or I had like a small percentage of them tell me it's because it was for prevention. And that was the case for me, where I had these irregular periods and then had acne, and they're like, oh, here, why don't you take the pill? And then about 3 or 4 years later, then I went off the pill. It was, oh, you have premature ovarian failure. Your only option of having a child is through donor eggs. And, and then years later, my health suffered, and I was put on the pill again after that to maintain my hormones. So then it impacts, the microbiome and the nutrient deficiencies. So did you want to talk about that? Because you're quite an expert.
Sure. Yeah. A big part of my book is about recovering from the pill.
Mm-hmm.
One thing to keep in mind is that it takes the female body 12 years to mature the signaling between the pituitary, the hypothalamus and the pituitary and the ovaries. I talk about that in chapter 1, and I quote Professor Geraldine Pryor,
mm-hmm.
who has talked about that before, this maturation process. And so one of the reasons that going on the pill young can then mean problems with periods later is that the communication between the brain and the ovaries has not had a chance to mature. One thing to just keep in mind is, it's different in what you describe in a situation of premature ovarian failure. That's actually quite a different situation, but a more average, like the more normal, like standard situation would be just being for a while kind of a state of stalled ovulation where you just can't get it going, or where cycles are irregular to begin with. And I think part of it is just allowing for that transition off the pill and recognizing the fact that this is potentially the first time the body's had a chance to ovulate in years, if not a decade or more. So it's about being a little bit patient too, and letting that the ovulations kick in, and potentially not resorting to fertility treatment too soon, because for many women, they're not going to need that next step.
Mm-hmm. So what's the timeline there? Sort of 12 months to 18 months kind of thing?
Well, officially, I guess if it hasn't been a cycle within 3 months of coming off the pill, I do agree that it's probably a good idea to see the doctor at that point and see if there is something else going on, like prolactin we talked about, or perhaps start to get an assessment for PCOS. But then depending on what the doctor's assessment is, if everything looks normal, then it might just be that you need more time, or that you need to eat more. And in terms of, I can't give a full one size fits all of what would be the number of months before resorting to fertility treatment. It's obviously going to depend on the situation. But with my own patients, often I'll say, well, let's at least get you ovulating regularly. And then you're kind of, if you haven't conceived in the next 6 months after that, then that's maybe more in the situation where it's time to look at fertility treatment. But at least, how they say you have to wait 6 months or wait 12 months, but that would be if you're actually having cycles during that time.
And then as far as the endocrine disruptors, then sort of the plastics or pesticides, things like that, did you want to share anything?
Well, with my own patients, I just say avoid them as best you can. I think one thing that worries me a bit is that it's possible to become quite fearful. If we're thinking about all the plastics and all the pesticides that we're exposed to, we can only do the best we can. So I think not, spraying pesticides in the house, not being exposed to them knowingly in our own homes, choosing organic as much as we can. For some women, that's more possible than others. Depends where you live and how accessible those things are. Yeah, and just making reasonable choices, keeping in mind some of the biggest endocrine disruptors actually are not even the plastics and the pesticides, but the toxic metals. So mercury is probably the big endocrine disruptor, the biggest one, the strongest one. And it comes from Yeah, sadly, it comes from eating certain kinds of fish. And there's been a couple studies shown where, women who do eat a lot of bigger fish, like tuna, have higher levels of blood mercury. So I think certainly when you're trying to conceive, that would be a time to choose smaller fish. Just be conscious of that.
Yeah, I'm saying to go for, wild caught salmon and the smaller ones, the sardines, which I just had yesterday. Yeah. And what's the other one? Is it mackerel? Is that a little one?
Yeah, it depends on the species of mackerel, but yeah,
small ones there. But I know when I was young, my mother, like I think in grade 7 back in in the 80s, she sent me to school with sardine sandwiches, and I was made fun of for the smelly sandwiches, but I'm like, I don't know. I personally like sardines. I think they're delicious. Yeah. And I guess with the water, obviously too, looking at purifying your water, because that could have, first of all, birth control pill in there as well as all sorts of other toxins, which could then be impacting your hormones and your thyroid.
Yeah. No, I think it's a good idea to get a basic, if nothing else, just a basic activated carbon water filter. Definitely. That's pretty easy. And that's important for both men and women. I would say that sperm is even more sensitive to endocrine disruptors than eggs are, actually. Mm-hmm. It's sperm are delicate creatures, which is one of the reasons it's so worth looking at the male side of things, because the things that men are exposed to, or the health problems they have, or the medications they have, could have a big effect on sperm. And at the same time, it's quite easy to turn that around and get better quality sperm from certain supplements like zinc or selenium, which help to protect the sperm from some of those toxins.
Mm-hmm, absolutely. Yeah. And as you make these changes with some of the environmental toxins, to not, as you were saying before, kind of not necessarily stress yourself out and throw everything out at once, just do it you can do it gradually. And for me, the diet thing, I was able to, and I don't do dairy, gluten, or corn. I'm sensitive to that. So I was able to take those out very easily for me. But the personal care and the cleaning chemicals, that took years for some reason for me to even do that. I don't know why. When you think about it, that seems easier than the food, but that was my experience. And so we talked a little bit about gut health. So why is that important for our period and fertility?
Well, primarily because gut, as you know, can be a source of inflammation, which can impair ovulation. And also the inflammation from the gut can affect immune function, which can impair implantation and holding a pregnancy. So we want to, if possible, reduce what's called intestinal permeability, which means reducing something called SIBO, or small intestinal bacterial overgrowth. I don't know if you've had that conversation already with some of your other guests.
But we talked about it.
It's a situation where the gut bacteria are living up in the small intestine where they're really not supposed to be, and that can cause the symptom of bloating immediately after meals. So that can be important. There's various treatments you can do to try to improve that. With some of my patients, if they are going to be trying for pregnancy, I might, before they start trying, I might ask them to do a course of a herbal antimicrobial, which can help to reduce the level of those bacteria that are not supposed to be there in the small bowel. And that can go a long way to reducing digestive bloating, improving gut health. And the second way that gut health affects hormones is, as we said earlier, that the gut is where the body normally clears estrogen and removes it from the body. So if you have unhealthy gut bacteria, then estrogen doesn't go out, rather it gets kind of reactivated and reabsorbed, and that can contribute to symptoms of excess estrogen and feed into that estrogen histamine cycle that I described earlier.
And then that herbal, what was the herbal, can I ask the herbal supplement that you recommend there?
Well, it would be a herbal antimicrobial. So that could be something like, I'll just mention, that could be something like oregano oil or berberine, but just keep in mind, those are not safe during pregnancy. So for your listeners, they'd really want to maybe talk to someone about when to use that or how to use it, or just use it in a cycle where they're not actually trying for pregnancy.
Mm-hmm. And then other things for gut health, looking at sleep and stress, and obviously not consuming alcohol.
Yeah, definitely. Why do you mention alcohol? That's a big one. Alcohol causes intestinal permeability. No, it's not great for health. Lots of reasons. It affects sleep quality. Yeah.
Mm-hmm. And so you talked about the testicular microbiome, and now the vaginal microbiome. And I did have Karan Krishnan from Megaspore or Mega. It's not that's the probiotic, but Megabiotic.
Okay.
He's a microbiologist there, and so he was talking about the vaginal microbiome, which is he was actually talking about when you go to your OBGYN and the gel they use to do the pap smear is actually just completely obliterates all the good vaginal microbiome, and especially women that are going through fertility treatments, they get that kind of assessment a lot. So it's just can be harmful for that. Do you have any?
Yeah, that's very interesting. No, I wasn't actually aware of that, and I'm going to have to maybe listen to that podcast. The science around this is still in its infancy, but I think we have reason to believe that both the vaginal microbiome and the uterine microbiome, those are two different things, have a big impact on fertility. It totally makes sense, especially with the uterine microbiome. So in terms of how to improve things, there's not a lot of research yet. I mean, your other guests might have spoken about some of the various probiotic products that can help to reestablish normal vaginal microbiome. There's some science on that. In terms of how to access the uterine microbiome, at this stage, I don't think we sort of have that information yet, but it's very much a kind of watch this space and think about it. Actually, one thing I will mention, just because I just shared something on Facebook the other day about, you probably know about this iodized poppy seed oil flush, tubal flush that gets used sometimes. It's super popular down here in New Zealand, apparently. So it's a, do you know about this? So it's a reagent.
No, I haven't heard it. No.
Okay, so I just put it on my Facebook. I forget the brand, it has a brand name, but what it is, it's 100 years old as a treatment. It's using poppy seed oil that has iodine in it. It sounds iodine in it, which sounds just kind of like a herbal medicine, but it's been a normal, conventional medicine. They flush the fallopian tubes with that, and they would do it potentially as part of the hycosis or checking the tubal patency. But then it seems to result in pregnancies after, which is they're thinking it could be because it's clearing the debris. Someone pointed out to me recently that iodine itself is antimicrobial. So potentially having a flush out of the uterus and the tubes with iodine could potentially knock out some bad bugs that are in there that might have been impairing implantation or somehow affecting things. So it's a pretty interesting technology. I think it's available from a lot of fertility clinics. It sounds alternative, but it's actually quite mainstream. So I can you can find the link on my Facebook from yesterday, or I can give it to
poppy seed oil. Sure. Yeah. I'll grab that. And then, and so what if someone has a lot of vaginal or yeast infections?
Well, it really is worth treating that, because that's an obvious marker that things are not right there in the ecosystem of bacteria that are living in the vagina. So there's different probiotics to use. The one I talk about in my book and the one I use with my own patients is a combination of two lactobacillus. One is rhamnosus, I think it's called GR1, and one is reuteri RC14. They're just particular strains of lactobacillus or probiotics that help to reestablish a normal vaginal microbiome. You take them orally. You can also insert them vaginally. I usually do both with my patients. And the goal would be no yeast infections. I mean, the goal would be to just have a normal, because the other problem with yeast infections and any kind of abnormal ecosystem in the vagina is that's potentially going to impair fertile mucus as well. You're not going to be able to see it as clearly. You don't have potentially the right environment for sperm.
Yeah, I had yeast infections for years. Just thought it was normal.
Oh, right. No, definitely not normal.
No.
The other one is bacterial vaginosis, which is...
Yeah, got that too. I had that too. I find when I changed my diet, that really a lot of that went away.
Yeah, this can be improved by diet.
And as we talked about thyroid health, but making dietary changes and looking at gut health and potential infections. Anything else you wanted to talk about around thyroid health and why it's so important for your period? Yeah,
well, it brings us back to the question around autoimmune thyroid. So you should probably, if you haven't already, have what's her name, Isabella Wentz on your podcast.
Trying to get her
a couple books about Hashimoto's. So you can have the whole conversation about all the different aspects to autoimmune thyroid and what to do. With my own patients, it usually means gluten. Strictly avoid gluten. Selenium. I might look at doing some gut work, a course of a herbal antimicrobial there's various, steps that can help with Hashimoto's. And just to put it in perspective, I don't actually think that everyone needs to avoid gluten when they're trying for pregnancy. I think it depends on what the reason is. But if there's any evidence of this autoimmunity or autoimmune thyroid, then that puts someone in the territory where they want to avoid it. And strictly, unfortunately, gluten's one of those things where when it needs to be avoided, it needs to be avoided completely, or it's not really worth doing.
Yeah, gluten light doesn't work. Don't even bother.
Gluten light, no.
Yeah, we look at doing the elimination diet, so taking out dairy, gluten, soy, corn, peanuts, and eggs for 10 days, and then systematically reintroducing it, and then seeing really how it impacts your body, because sometimes you just don't know. And it's usually the thing like, oh, I can't live without X, Y, or Z, and that's what you're intolerant to. I think if I tell this to people, they're like, I can't give up cheese. I'm like, well, that's probably what you're intolerant to, or I can't give up my bread. Well, chances are that's it. But sorry, go
I was just gonna say, for gluten, sometimes it can take more than 10 days though, or 8, whatever it was, 10 days to see the difference. Sometimes with true gluten signs, it can take a couple months. So usually if I've decided that gluten is worth removing, I might say, we need to do it for 8 weeks.
We have it. So it's like the 10 days, take it out, and then systematically reintroduce it over the course of 30. Gluten would be the longest. And then a lot of times for our people that we're working with, we say, just don't bring back in dairy or gluten. Sometimes people just want to see, oh, how does it make me feel? Oh, wait, when I've taken it out that long, now I know gluten makes me feel a certain way, digestive issues or mood or skin rashes. Yeah. And exactly, as you say, taking out for longer is beneficial. Yeah. And so what about mind body suggestions to help with stress around that would be beneficial for the period?
It's about having permission to rest, whatever that looks like, whether it's just stopping work a bit earlier, making time for not just exercise, but just to sort of be on your own. Yeah, I don't think there's any one size fits all mind body plan. Certainly with my patients, I try to tune in on what it is that they love to do. Mm-hmm. If they play a musical instrument, then it's about making a few hours in the week to do that, as an example. And
do you have any go-to resources that you personally like or you recommend to help them?
Yeah, well, in terms of relaxation, I can just talk about a couple that I use. I have a set of audio meditations that I find quite helpful. I do think meditation is a worthwhile addition for people, just because it's a way in. Even just slowing down for 10 or 20 minutes a day somehow gives the body that permission to make other choices to slow down. Mm-hmm, mm-hmm.
Yeah, I love doing meditation, and I like the app Calm, or Insight Timer is a good one too. It's got some really good meditations. Or I've actually recently I've just been putting on my Apple Music and then putting on a timer and then finding spa music, and usually they have some sort of Reiki or something playing there that's instrumental, which I love, and feels like you're in a yoga studio relaxing, so it's nice. And so as far as how long would it take to see results on some of these things, that's like a huge question, and it's hard to put a timeline. But as far as if we're seeing issues around the period and we dig in further, is there any kind of...
There's a pretty long time frame.
Yeah.
So for example, if a woman's not ovulating because she hasn't been eating enough, it's about committing to a lot more food, potentially a lot more carbohydrate. This is just an example. And that could take 6 months to produce ovulation from that stage, which is, I know, one of the issues with the fertility patients that I do work with is that the time frame, it's much tighter than that. I always feel so conflicted when I sit down with a patient and she's like, okay, I'm going to give natural treatment 2 months and then I'm going to IVF. It's like, well, I've said multiple times, actually, that's not going to work at all. Unfortunately, that's probably not going to work, because it really, to work with your body and get it to do what it needs to do, minimum 3 months, even just to get started, probably more like 6 to really start to see results. And sperm is the same. Actually, getting better sperm takes 100 days as well. Yeah. So 3 to 4 months. So you put in treatment for sperm, and then you have to wait 4 months to see let's call it super sperm, to see what comes out the other side eventually. It's worth, I would say, even in a situation where women are worried about their age or feeling really under pressure, it's still worth, I think, giving it a little bit more time.
Yeah, and really working on your health there's no downside to that, because if your period if there's something going on with it, be it irregular periods or PMS or you're not ovulating, that's a clue as to your health. And then to me, forging forward towards IVF when you haven't really figured out the root cause of what's going on, there's only a 30% success of IVF average. So working on this for 6 months, although it could seem 6 months does seem a long time when you're in a panic and you want to have your child now, but in the grand scheme of things, really focusing on your health and then looking at your postpartum and the health of your child and epigenetics and kind of looking at the big picture, it's not such a big thing. But when you're in the middle of this, it does seem like a long time to say, wait, we're going to pause this for six months, but it's not like we're doing nothing. We're making major change that could help. How do you present that with patients? Is there anything that you talk to them about, or?
Well, just what I said, that everything minimum, anything natural is going to take 3 to 4 months to even show a result. So that's just the way the body works, unfortunately. So if the time frame, there's no way to promise or deliver anything faster than that. Yeah.
So is there anything that you're obsessed with right now that you're loving, as far as a book or a website or an app? Or we're obviously going to link to your wonderful book, but anything that you're just obsessed with right now that you want to recommend?
Oh, that's a good question. I'm actually reading a book about evolution right now, because my former work is I'm an evolutionary biologist, so I do have a love of science. So I'm reading a book about the evolution of plants and animals in New Zealand, where I live. So yeah. But from a health perspective, there's lots of other good stuff coming out as well. Yeah.
Nice. Okay. And what's the name of the book that you're reading?
It's called The Ghosts of Gondwana. Gondwana was the old, back in the Cretaceous, big landmass where Australia, New Zealand, South America, everything was all joined together as one.
Ghosts of Gondwana. Awesome.
Yeah.
And is there a success story you wanted to share with the listeners? I'm sure you have lots.
Oh yeah, no, I didn't prepare. I think the biggest success for me has been just some of the reports from readers reading Period Repair Manual, and you can read a lot of those just on Amazon. Actually, just people saying, "I got my period back," or one of my favorite reviews was from someone who said, "Wow, I had no idea that what you eat could affect your health." Yeah. So I think one of my biggest successes is just getting that information out there, that some quite simple changes in diet and some quite simple, inexpensive supplements can translate into some pretty big differences in terms of ovulation and period health.
Are there any go-to supplements? I forgot to ask you this question. Any supplements you'd like to just sort of say that are it's hard, it's individual, but...
Well, I'm going to say magnesium. Thinking about one of my Amazon reviews, one of my favorite reviews that I ever got. She said, basically, take magnesium. That's the message of the book. But there's lots of other good stuff in there too. So, there's different, obviously there's lots of different supplements that you can choose from, but one piece of advice I give to women is don't load up too much on supplements. I don't think anyone should ever need more than sort of 3 or 4 things going at a time. So you should be able to choose one. Another example I'll give, one that is very helpful for PCOS is inositol. And it's really only something I've been prescribing only the last maybe 3 to 4 years, since the research about it has become so clear, but it certainly does work and help when the main problem is PCOS.
Mm-hmm. The insulin resistant side of things, yeah.
Yeah. Well, it works on ovarian signaling as well, actually helps to promote ovulation directly.
Awesome. And so you're offering a download of the first 2 chapters of the Period Repair Manual. They can go to... I'll put the link in the show notes. Is there a link that you wanted to, where they can go just verbally right now, or? Yeah,
so my blog is larabriden.com, and all of my social media is at Lara Briden.
Awesome. And they can download the 2 chapters there. Anything they wanted to talk about when they'd get in those chapters?
Yeah. So the first chapter is called Period Revolution. It's about why it's important to have real periods and not be on the pill. And the second chapter is a lot about the problems with hormonal birth control and some of the things we talked about before, how it really works by inducing a chemical menopause that can then take some time to recover from.
Absolutely. Definitely check out the Period Repair Manual and check out, go to Lara, Lara Briden, BRIDEN.com and check out, and you can download the 2 chapters of the book there. And thanks so much for coming on the podcast.
Yeah.
Your words of wisdom, it was a fun conversation.
Yeah. Thanks, Sarah.
Hey there, Sarah Clark here. So are you struggling to have your baby? First of all, please know that my heart goes out to you. I support couples worldwide who are struggling with infertility to conceive and have healthy babies. Women like Rita, who gave birth to her beautiful daughter after following my fertility coaching system. Or Danielle, who after 2 failed IUIs was able to get pregnant after a supercharger fertility discovery call with me. So here's how you get my help for free. So I offer a free supercharger fertility discovery call. And on that call, I'll create a plan with you that is going to help you fast track your success. So this call is not for everyone. And I'm really picky about who I get to speak with. And I have a strict but totally reasonable criteria that needs to be met in order for us to move forward. So here's who I can help. So first of all, you need to be able to explore your infertility diagnosis in a new light. So this offers for people who are open-minded, they're coachable, and if you can do that and want to double or triple your chances at the fertility clinic or get pregnant, awesome. So let's get on the phone and chat. Also, you must be an action taker. So someone who's committed to seeing results, you're able to follow directions. Don't worry, I'm not going to ask you to do anything bizarre. But if you're one of those people who like to consume a ton of information, but don't like to spend time implementing and seeing results, then the call's not really for you. So I only want to spend time with people who are genuinely committed to their own success. So just click on the link in the show notes and apply, or go to fabfertile.com and click on the free consult. So it's a really short application that just tells me about your health, how long you've been trying to conceive, and how soon you'd like to be pregnant. So seriously, this is going to be the best time you've ever spent on your fertility. Looking forward to chatting. Talk soon.
Thank you for listening to Get Pregnant Naturally. Seriously, it means the world to me that you're here. Make sure you hit the subscribe button so you can be notified of upcoming episodes. I'm excited to offer you a special gift. If you're a U.S. resident, text FERTILE to 345-345. You'll be prompted to enter your email address and you'll receive our Fertility Yoga download. In this 20-minute intro video, we focus on a calming and peaceful practice to connect back to your heart. These simple fertility yoga poses can help quiet negative thoughts and make you feel more in control. Download it now and get started today. So for U.S. residents, text FERTILE, FERTILE, to 345-345. For non-U.S. residents, go to www.yogafreebie.com to access your special gift. That's www.yogafreebie.com to access the free fertility yoga download. And I love this quote by Dr. Mark Hyman, medical director of the Cleveland Clinic Center for Functional Medicine and chairman of the Institute for Functional Medicine. Functional medicine is medicine by cause, not by symptom. Functional medicine practitioners don't in fact treat disease. We treat your body's ecosystem. We get rid of the bad stuff, put in the good stuff, and because your body is an intelligent system, it does the rest. Thanks for listening. Until next time.